Okay.
This is Dr. Dawn Ewing. This is the IABDM Zoom meetings that we have. Tonight we have a dentist that is going to teach us about how to become a biological dentist from a startup. This is Minaxi Mirkal, and she's
Hi,
been with us
everyone.
for a few years. So I'm going to turn it over to you right now.
Everyone, my name is Minaxi Mirkal. I am a biological dentist. Name of my practice is Prime Integrative Dentistry. We are located in Flower Mound. As you know, Dallas is one of the, I would say, saturated cities for dentists. So, I mean, there is a population demand, but there is also many dentists. So, I was still able to do a startup, a very successful startup, in comparison to all standards of a startup. And I did it. And I think the reason I was able to do that was because I did a biological dental office more than anything else. There were patients seeking this kind of care from day one. So this is going to be my recommendation for anyone who's just out there, wanting to get themselves established in dentistry. But of course, you also need to bind the philosophy. You just cannot do something half-hearted. I see a lot of people on many websites who want to get into biological dentistry because, it's easy, or they think they'll make more money and all those things. It's very important to always have your why in place. The money part always comes, and you'll at the end of the day, you always have to enjoy what you're doing. So I would definitely start there. So I'm just going to keep this very informal and casual. If you have questions, just ask. I'm just going to go over some of these slides and pretty much talk about what comes to my mind, experiences that I've had, and I'll be happy to take any questions at the end if someone has. Okay. All right. So to start out with, thanks to Dr. Teresa Scott, who's our president of IABDM, and she has made it biological dentistry a lot more popular than when I actually started out, and it's great that she's doing all this, and rightfully she's the president. So biological dentistry, as we all know, it's nothing, nothing fancy. It's just the same dentistry, but done with a fresh pair of eyes, being critical about and looking at everything with new eyes and trying to see, what am I doing? Am I doing the right thing? Am I protecting myself? Am I protecting my patients and my staff? Those simple kind of questions. And it also goes back to us as doctors. The first thing that we do is we take the vow, do no harm. So we always have to go back to that and try as much as possible to reduce, if not, you're in dentistry, one of the most toxic professions. There's still going to be few things that we don't have control, but as much as possible, reduce the toxic burden on our patients and ourselves as well. Okay. So that is about biological dentistry. A lot of the times when new dentists step out of dental school, they're kind of confused. They like the idea of biological dentistry, but they don't know where to start. So if you're a fresh dentist who just graduated a year or so, you've been practicing conventional dentistry, and you're thinking of doing a startup, my suggestion to you is definitely take a look at biological dentistry. This is the best way to practice, and doing a startup, if that is something that you want to do, then doing a biological dentistry startup is probably, I would say, the best way, because it worked out beautifully for me. Okay. When you're out there to practice, to purchase a practice, you'll come across well-established offices who've been making ABC and who've been in business for so long and all those things. But at the end of the day, you always have to get back to the basics, get to the crux of the matter. So what are the numbers? Always know your numbers. What is the overhead of the practice? Always have to know that. Most of the offices that are insurance driven, you're looking at an overhead of 70%, 65 to 70%. The most well-run office. I've been an associate for a really long time. I waited for the longest to buy a practice. So I can tell you most offices that are insurance run anywhere between 65 to 70% overhead. But if you are to compare that to a biological office, which is most of the biological dental offices are fee for service, that number is much lesser. It should be anywhere between 40 to 55%, nothing more than that. Okay, and when you're fee for service practice, then usually your overhead is low for so many reasons. But that should not be the number one reason why you should consider doing a startup. The first and most important reason has to be the philosophy. You have to know what biological dentistry is. You have to, believe it, because you would be practicing a certain way for the rest of your life, or at least to the point where you decide to not practice or sell the office, something like this. So this is a very important decision. Take that time, ask yourself some difficult questions. Am I okay not doing fluoride for my patients? Am I okay telling them comfortable and confident and myself believe that, these mercury amalgam fillings are not safe and they're toxic and they do ABC to your health? So these are the conversations you'll be having on a day-to-day basis. Okay, so you should be able to bind the philosophy. The reason somebody should consider doing a biological startup versus buying a practice is, number one, always philosophy. Of course, most biological offices are fee for service, so the numbers definitely look better. Especially for women, it's a great way to practice because it gives you a lot of flexibility. At this point of time, I'm working 4 days. And that has been the case from day one of my office. And, you can work much lesser if you're a fee for service practice and still make the same amount of dollars. So some of the questions that people are doing a startup, and if you're in that group of, okay, I know for sure I don't want to buy an existing practice and I want to do a startup. Some of the reason why people choose to do a startup versus to buy an existing office is a lot of the existing practices are extremely expensive. And then that could be a reason if you didn't get a loan from a bank and you just got approved for small amounts. Say, for instance, most banks lend you up to 500K if you're doing a startup. And most offices that are out there for sale are anywhere between 500 to 800 if they've been in practice for 5 to 10 years. So that's another good reason why somebody should consider a biological dental startup. Always start with the end in mind. If you've already done the step one where you've done Dawn's course, you've done other ozone class and other courses that have been conducted by IABDM, and okay, this is the way I want to do. Or even if you have an existing practice and you want to transition it to a biological office, you always have to start with the end in mind. This is what I want my office to look like. These are the services I want to be able to provide my patients.
Oh, I think we lost her. Yeah, she dropped off the list. Sorry, everyone. Her internet must have gone bad.
Let me try to, maybe, I'm not sure if she'll figure it out. So let me try to email her. All right, I sent it off to her. Let's see what happens. getting much harder with so many people using Zoom and different ways to connect to get good internet consistently.
Mm-hmm.
I know that's the problem that we had with Al Dannenberg the other day, poor thing. It was like,
So this is where I think we left off. Where do I start? Always start with the end in the mind. Okay. Write down every detail of what you want your practice to look like. You know, I always wanted to make sure that I had a library in my office so that when patients are waiting, at least patients who are seeking biological dental care, they they are mainly well-read people. You know, they look for stuff. They're independent thinkers. So anything that kind of stimulates them or is on the same lines of their thought process definitely helps bridging that gap. These patients are very hard to please, but at the same time, they're believers. So you have to kind of understand the psyche of your patient pool of people who you're serving. So I have a nice library in my office. I myself like to read books, and I keep all these books. So make sure you kind of take that time to think about what are the things that are going to be in my office. How is this going to be different from somebody else down the lane? Because you're saying that I'm not going to practice, I'm not going to be taking your insurance, I'm going to be fee for service. But at the same time, this is a value-based practice, right? So if you're a value-based practice, you have to set yourself apart from somebody else. And that's very important that we kind of give some attention to that. Okay. Again, always start with your numbers, ask as many questions before you even get into the process. Give yourself 8 to 10 months time, you know, for you to plan before you can actually be open, up and running. The first month, I would say take the time to think, what are the procedures I would like to do? What are the things I would like in my office? What are the equipments I would like to have, and things like that. So I'm going to kind of go over the things that I did, and I kind of did it haphazardly, but now when I look back, had I done it in this way, it would have been more streamlined. So anybody who's out there who's doing a startup process, probably this will help you. So ask yourself whenever you have some downtime, ask yourself as many questions. It's important to ask questions to yourself so that you know, you'll get those answers, not right away, but probably in a little bit of time. So that way you're trying to be most, you know, truthful to yourself. You know, this is what I want, and this is the way I want things to be done in my office. And again, the whole startup process requires you to pick up a location and your whole startup team. And that goes for the conventional startup, the same as, you know, biological office. But there's one thing that I'm definitely going to kind of put attention is when you're picking your location. Okay. When you're picking your location, most startup people know that you have to start by doing a demographic search, which basically talks about, you know, dentist to population ratio. Most doctors look for a number of 1 doctor for every 3,000 to 4,000 population. But when you are trying to do a biological office, that may not apply to you. So there are 2 things that you need to keep in mind when you're doing, when you're picking a location. I'm going to talk about, I'm just going to, you know, fast forward to this point because it's important that we touch this. So there are 2 things that you have to keep in mind. When you do a demographic search, do your regular demographic search with companies like Dentographics. They'll spit out a report of, okay, if this is your area, then this is the dentist population ratio. Keep that at one end. And the other demographic search that you're going to do is you're going to be doing this for yourself, okay? Go to IABDM, IAOMT, and Holistic Dental Association website. Look at all the dentists in your in your state, and then just go on Google Maps and drop a pin, okay? That'll give you something like this, okay? That'll give you something like this. It'll give you a map of your state or, you know, of your city, and look at how many dentists there are. And then compare that to your demographics search report, and then depending upon what criteria you have set for yourself. For instance, I wanted my office to be 15 minutes drivable distance from my home. So I set that location. My broker came up with 4 or 5 spaces in that location. And then I looked at this report and say, okay, how many biological dentists are near me and what are the procedures that they are doing? So kind of have a sense and feel of the location and of where you're opening up your office. So it's important to kind of keep those things in mind and pick a location. When you're actually deciding between location A and location B, once you have narrowed to the zip code, now you're looking at 2 locations. One thing that you have to keep in mind, at least this is what worked for me, and I'm thinking this is the case for most offices. These patients who are seeking biological dentists will drive to you, okay? On a consistent basis, most of my patients drive 1.5 to 2 hours one way. I'm talking about. It's not unusual for my patients to drive that. So it really does not matter if you're at the store front paying $6,000 to $8,000 as rent, or slightly behind or more in a professional complex where they may have to take an elevator to come and see you, something like this, where the rent is almost half, like $3,000 or $4,000. So just by picking the right location, you are reducing your overhead. But you have to compensate that location visibility by showing that you're a person of value. And that's something you cannot compromise as a biological dentist. That means making sure you're keeping yourself updated with the current knowledge that is out there in biological dentistry. Take all the courses that have been listed, go to your meetings, annual meetings, and yearly meetings that are conducted, and just keep yourself abreast so that if you know what's out there, you'll be confident. You know, if you'll be confident, it's much easier for you to talk about what your patient's asking. These patients ask a lot of questions. Before they even come in, they have like 15 questions ready for you. So initially it's a little overwhelming, but once you get a hang of things, once you yourself are on the same path, this only makes sense. For me, as a consumer, I'm just like that. I'm just like my patient. If I go to a practitioner, I ask zillions of questions. So somewhere it has to be, do you really believe in this for this to make it work for you? It made absolute sense to me. So I would definitely say that about demographic search. And let's see, these are some simple things. They apply in general to life, not necessarily biological dentistry. But what are the factors that determine your success? You have to be ready from day one. You have to plan to stay busy from day one, okay? Offices that open, startups that open, and then like the first week, they're still getting their computers, they're still getting their softwares. You know, that's just, you're just bleeding money at that point. You have to make sure that the money that your landlord gives for that first 6 months of free rent, you make the most use of it. You need to have a home office where you have a computer, where you have your software, you're paying for your software already, and your software is ready to make appointments and schedule appointments. You need to have a phone. If you're working as an associate somewhere else, hire someone, hire a student, hire, you know, someone who's trying to get into dental school and they would love to get their feet wet. So that's exactly what I did. I had someone who would just answer the calls, who would take the questions down, who would make an appointment. My schedule was booked before my office was open. I had to reschedule 3 times because I didn't get OC, occupation certificate. And my patients were, some of them rescheduled, some of them canceled, but at least those are good problems to have, okay? So always think of being ready to start seeing patients from day one. And time is money and time is freedom. So for you to be successful as a startup, you have to make sure you're busy from day one. I touched briefly on this. Pick a location that is not necessarily on a busy street, has big signage and stuff. So that's my office. If you see, this is not exactly on the street front, but the building is pretty good. It looks beautiful to me, of course, but it's not exactly at the street front, and it still makes a lot of sense. I get close to 45 to 60 new patients every month. All of them mainly come from my website, and they also come from Facebook groups where I volunteer to help people answer some of the questions. These are easy things that you can do to put yourself out there. The first 6 to 8 months before I was open, every week I used to go and meet a holistic practitioner. Okay, that was my marketing. So I'm going to talk about that a little bit once we start going into the marketing part. So prioritize your spending money. So it when you do a startup, it can be an overwhelming process because you have to juggle 10 things at a time. You know, you have to see if the contractor got the permits. You have to see if the equipments are coming in on the right time, and you still going and meeting people. So there's so many things that is happening at the same time. The most important thing that I can tell you from my experience is don't lose a sight of time and the whole project. Everything, it's like playing an orchestra. Everything has to bind together. Don't spend too much time trying to get deal. Once you're open, trust me, that little money you spent so much time to get a deal was really not worth it. What is really worth it is you being able to open on time. Very important. Open, make sure that is like your one of number one things. You have to be ready to be open and open on time. Those are two important things that anybody who's doing a startup should keep in mind. At the same time, don't be emotional about buying things, right? Like, especially if you're meeting these reps, they will tell you, you need to buy forest chairs, you need to match the color of your chairs to the color of your paint and all those fancy things. These patients will still come if you don't buy a fancy chair, as long as you have the knowledge, because some of them really need help. Some of them really have a complex history. They're struggling on a day-to-day basis. And you have to keep a balance between what is important for you, for your practice, aesthetics, and things like that, and then spend your money. Everybody is different. So for me, the most important essential buys were definitely a CBCT. I see a lot of people who are doing startup, they'll buy the most expensive, beautiful looking chair. They're almost like Ferrari, but then they will kind of nickel and dime on buying stuff like a CBCT scan. I would do it other way around. Buy things that'll help you and your patients look at stuff. I see this all the time. Patients come in, they have a root canal treated tooth. It may not have symptoms. Sometimes the patients say, I just sense it's not okay. And then I take a CBCT scan and there's a big low-grade chronic lesion. And you will never find that on a panoramic X-ray. You'll never find that on a PA. So CBCT is a must buy for a biological office. So buy a CBCT. These days you get CBCTs as less as 66,000, and then you have financing and stuff like that. So buy a CBCT. That's an essential buy. I say buy all the smart equipment. I know a lot of them say, oh, but it cost me around 10,000, but it's worth everything. You'll probably make that in the first month, if not in the first few weeks. Smart equipment is absolutely necessary because you're going to charge your patients a fee for the restorative procedure. At least start with one ozone machine. Dr. Eric Zemrisky is amazing. I wish I had known him before I got into ozone and stuff, because he made ozone so affordable for new dentists who just are making that move to biological dentistry. So buy an ozone generator with him. He's amazing with his knowledge, always readily available. And that's the first starting point. If you're into surgery, buy the PRF machine, because I can tell you, you can buy the most expensive graft material on the face of this earth. It's not going to be half as good as your own blood, okay? learn the techniques, go get a phlebotomy course. So if you're into surgery, PRF should be your standard of care. Washer and dryer, especially after going through the whole COVID situation, I think everybody at this point, if you're thinking of doing a startup or transitioning, get a washer and dryer in the office. Okay. Marketing. For me, I heard this in a seminar, and it actually absolutely made sense to me. And then I've always kept this in mind and kind of geared my practice around this. Either sell what everyone is selling, but at a cheaper price, or sell something different. So, and this happens all the time. If you look at marketing material of some of your colleagues, it's like, I'm going to give you away this, I'm going to give you away that. It does not make sense. You just, when you market something, you're asking for more of that. If you market that you're giving a deal, then you'll get more people coming to you asking for a deal. It's just, it's as simple as that is. Don't ever say, I mean, of course, give a deal. I'm not saying don't give a deal. I always, like when I have patients above 65, I always give them 5% off any treatment they do. Just, you know, they don't even have to ask. But just kind of, it's like your own marketing can spoil your own business. So just when you're doing marketing, focus on adding value versus adding a deal. Because if you're saying giving something for $10, somebody else is ready to give that for $8, then what are you going to do? Give it for $7? It does not make sense. So that's a big takeaway. So when you're into marketing, your marketing should be geared at telling people that we are value-based, we are doing this, and not necessarily, you know, we have this special going on for this month and you're gonna get a great deal out of this, okay? Again, for biological dentistry, these people are not actually looking for a deal, they're actually looking for someone who understands them, who has as much knowledge, if not more, as them, at least, because a lot of the time these people go to regular offices, and most of us, most conventional dentists, roll their eyes or just, you know, belittle them, tell them that it's all in their head and, you know, mercury is safe and things like that, you know. A lot of the time they just need to be heard. Second thing that I've seen with these patients is they're extremely knowledgeable. I have learned so much from my patients. It's like, it's amazing. These are very well-read people. So give them credit for that. Know who you're serving, and probably I'll give you a deal may not always work. So how do you market? What worked for me is I diligently went and met every holistic practitioner in my town. So in DFW, I made sure I Google search for holistic MDs, holistic chiropractors, holistic naturopaths, all the permutation and combination of those searches. I printed them out. I called every single number, and then I said, hey, I'm a new biological dentist. Do you have some time where we can sit and talk? I need to make these connections because I'm opening my office. My patients will need your help, and I'm thinking you would like to know what I'm doing. So most of them are extremely kind, and they almost always are open to setting up an appointment and meeting people. Some of them do require a little bit of time, but that's okay. But as long as you're trying to make an effort, even trying to set a goal for yourself of meeting one person in a week, and then those things add up. So there'll be so many doctors who already know you. And if they know that you're a holistic practitioner, they'll be more than happy. They're actually waiting for you. So this has all happened to me. I went and met some of the practitioner, and then I said, hey, my office is going to be open in a month. And they actually started sending me patients in a month, and my office was still not ready. And then I had to go back and apologize. So all these are good problems to have. But it does not happen until and unless you don't put yourself out there. So take that extra effort, massive action. I always believe in that. So you have to, until and unless you do it, it's not going to happen for you. Lunch and learn. If you're good at presenting, volunteer to speak. There are a lot of mommy groups, like I'm a part of Holistic Moms group, and these bunch of amazing women who really care for their family and trying to educate themselves to take great care. So I'm a part of that, and I volunteer there sometimes to speak. There's so many other things that you can do to put your name out there. So those basically ground marketing is, I would put that in a word, that really helped for my practice. I did not spend any money on mailers. I've still not done any mailers so far. So that has definitely helped me. So year one, no money spent in mailers. I have the least visibility among at least 5 to 8 dental offices around me. So I think I'm still able to do it, and anybody who follows this should be able to do it. Join professional organizations like IABDM, IOMT, and Holistic Dental Association. I'm sorry, it doesn't take right there. Your marketing language is important. It should not be geared towards saving money, but should be geared towards providing them knowledge, answering their questions. Very important. A lot of mommy groups, a lot of holistic, groups, a lot of people who are heavy metal toxic. There are Facebook groups on that, and they're asking questions. And you have to educate yourself too before you are able to answer that. So if you've already made up your mind, if you've already smart certified and done the biological 101 group, take time to read more books and educate yourself, and just look at some of these posts. These people are asking really very valid questions. They've experienced that. If somebody has experienced it and we don't know, does not mean that it's not true, it's not happened. We have to at least give others the benefit of doubt. That's very important. Website. It took me close to 8 months to finalize my website. It took a lot of time. The first thing I would do is make sure when you're deciding which web designer to use, make sure you let them know it's going to take time for me to actually come up with my website. I'll give you content and improvise it. Would you be okay doing that for me? Most of web designers have a cookie cutter type of thing. They'll just want you, give them material, put it up, and that's it. So make sure you have that rapport with your web designer. What I did was my web designer put a temporary page before my office was actually open. So my web designer put a temporary office coming soon kind of page, which was hosted and everything and live somewhere in November timeframe, and my office was open April. All that 5 to 6 months, I still had patients calling me, everything. So what I did was, even on my temporary page, there was a blog section. So if you have some blogs, make sure your temporary page has a section called as blogs, read more kind of thing, because these people will read and these people will make a decision. Okay, I really like this person because they kind of know what they're talking about. I would like to make an appointment, or just ask more questions. So make yourself ready, put yourself out there, and then it's so much easier for people then to call you. So you should have a Google Voice message number, email address, a blog on your temporary page. This should be at least 6 months before your office is actually open, okay? And somebody who's actually answering the phone. So your website, and also your Facebook page. Your Facebook page should be up at least 6 months. You should be posting, doing videos. I'm not good at videos at all, but younger generation, they're so good at those stuff. So make videos and post it, introduce yourself and things like that. So let's look at cost of doing a startup. I borrowed $450K. I actually ended up spending $400K. I returned the $50K back to the bank. And my whole finish out was $170. Equipment, I did buy 4 chairs, and I didn't buy it from the big companies, the big dealers, but I bought new chairs from my dental repair guy, and he gave me warranty. I have the receipt and everything. So these are all new equipments. It does not have the big sales price on them. So I got a good deal on the chairs. IT, computers, and decor, office essential. When it comes to office essentials, I made sure every room had a essential oil dispenser. I got, as far as TV is concerned, I got it's called as Food Matters. It's an annual subscription. It has a bunch of holistic stuff, be it food and other stuff. So if some people are into watching TV, I have that channel going on. The good thing about that TV is they have the movie, which is Randall's movie on amalgam filling. So that plays in my lobby all the time. So I have that going on. Decor and stuff, everybody's different. So you choose something that works best for you. So small instrument was 10K, signage, everything. So the whole cost came up to 400. So the whole cost, and that also includes the cost for CBCD. Okay. So as a startup, it's very important. Cash flow is king. Keep your overhead low. Some of the things that I did to keep my overhead low as a startup was I outsourced billing. Okay. A lot of holistic offices can range anywhere between we are taking 1 to 2 insurance to we are out of network providers wherein we'll collect your portion and we'll wait for insurance to collect their portion, to a fee for service office where we'll collect the whole amount and we'll bill, we'll file your claim and your insurance will send you the check in 2 to 4 weeks. To someone, we will not file your claim, we'll collect the whole thing up front and we'll give you a super bill. You can file your claim with your insurance. It can be any of those. For me, for my office, what worked very efficiently was we are fee for service. We collect the whole money up front. We file the claim, but I have outsourced it to a billing company, claims and billing company. The reason why I do that is their turnaround of processing claims is so much faster. So even though these patients are paying me upfront, they're still getting paid by their insurance company relatively fast. So they don't have to wait for weeks together. It's usually 2 to 3 weeks time and they get paid. So they don't feel that brunt, I'm shelling this money out from my pocket, and then there's always the buyer's remorse, right? So even though I'm collecting the money upfront, it is my top priority to make sure my patients are getting paid. And these are simple. I don't use any codes that I know that most likely won't be paid, covered. So usually it's basic like new patient exams, x-rays, and fillings and stuff like that. As far as codes like your own smart or ozone, those are some things that will not be covered by insurance. Patients need to know upfront, and that's something it would be technically out of pocket. But the language that we use in my office is more or less, if you have PPO, PPO insurance, it's going to cover 2,000, like the whole max for the whole year. Doesn't matter if you're doing a filling, cleaning, everything, anything. So if your treatment plan is around 10 or 15,000, just giving you an average that your insurance may cover 2,000 towards it. The rest is going to be out of pocket. So you can break it down into per appointment, or you can break it down into, how you want to do it, installment or care credit or whatever third-party financing. So kind of make it into smaller chunks that helps them to still get the dental work done and still get, find value in what you're doing. It's very important to keep that balance for them as patients and for us as well, to make sure that, we're seeing enough patients. The other thing that I provide for my patients is a membership plan. It's in-house membership plan. If for people who don't have insurance, you guys can go to my website, which is texasholisticdentist.com, and go to Prime U membership plan. It's a relatively simple plan. Most offices are doing that, especially if you're a startup. It talks about, just like the annual fee, and these patients most people who don't have insurance kind of think twice before going to a dentist, right? So we want to take that fear away. So we just charge them an annual flat fee, and that covers for all the exam, all the x-rays, all the emergency visit. and whatever treatment they decide to do would be 25% off. So it's pretty straightforward. I still have to see someone who says no to that, because what are you going to get for $250 an annual fee? For me, the goal for doing that is to provide biological dentistry at a price where they'll not think twice to come in. So that was my intention there. Let's look at some of my numbers. This is 1 year. I'm 1 year into my office. My average collection was for the whole year was around 66. We made close to 800K. I took a 1 month vacation, and my overhead is close to 38%. But let's just, for the sake of ease, 40% profit, 60% paid off 30% of practice debt. So this is something that anybody can do. Okay? And I have like 4 to 5 staff team members. So with that included, I think this is definitely doable for anyone. So this is how your startup should be. You should not be scrambling for money, and you should not be scrambling for patients. I'm not sure if I put that slide in, but the number of new patients, I put that too. I have anywhere between 45 to 60 new patients. And these are the 90% of my 30% of my patients are coming from holistic practitioner referral. A good chunk is coming from my online presence, from my website, from my Facebook page, and information that I've put online. And then there is another 20% that comes from holistic organizations like IABDM, IOMT, and things like that. The other thing I also wanted to say is just make most of the places have some kind of local organization. Like we have Natural Awakening. This is a magazine. This is a local magazine that's around in Texas. A lot of holistic practitioners advertise in that magazine. So I have my name out there in that magazine. So if you have something like that, don't hesitate. So it has to be, your marketing has to be geared towards getting people who are already on board with the philosophy of biological dentistry, getting them indoor, versus just trying to get anybody indoor. Then you're trying to convince them that biological dentistry is the way. I mean, at some point, you'll still come across patients who still come to your office knowing little about biological dentistry, and you spend that time, that's okay. But we're trying to get those people who are already on board. Okay? Learn from others' mistakes. I spent too much time trying to cut costs, which took my attention away from the overall project. So don't do that, and always build with the end in mind. My layout at this time, I wish I had one more op completely empty, where I could do some of the other things that I'd love to do, like have someone come in and do IV vitamin C and things like that. So there's so many things that you can do. It's just like once you start getting into the biological dentistry world, it's like, oh, I want to do this. It's like learning never ends. I still get excited about these things, and always try to keep the end in mind. This is how I'm going to be. If you are planning to do a startup, then also other suggestion that I have is go and meet other offices who are already up and running biological dentists, and kind of look at their offices, see what they have done. There's so many ideas. Most of them are always happy to kind of share their experiences. Can I answer any question? I think I'm pretty much done at this point.
Minaxi,
Yes.
where do you suggest you get staff members? Because most of the staff members that are out there are not in biological offices. And so can you address training?
Yes. So that was the hardest part. I'm so glad you asked that question. I totally missed that point. So I made folders, and I'm happy to share that here. I'll probably have to go to my office and scan it. I made folders for my assistant. I made a folder for my front, because I don't see how I just post on Dental Post, and in my ad, it says that I'm a holistic office. We do specialty procedures. Please look at my website. And then, you know, and then we go about scheduling. I think this is a great opportunity. Don, I don't know if you can make some kind of outlet, or probably, I think you've come up with a training, right?
Yes, we have. We have a certification for everything from the front desk to the assistants to the hygienists.
Oh, that's great. So there you go. There's the answer. You don't have to do stuff that I'm doing the hard way. So just send them. It is so worth it when your staff is on board, because otherwise you'll be so tired, because you'll be the only person talking, and most of the time they're clueless. So if your staff is on board, it is 90% of your job done. It is so important. So please, anyone who already has staff, they should be sending them to Don. I'm happy to share the stuff that I've made. I just looked them on Dental Post. Don, I don't know if you can make something like post an ad that is, we have something like that, right? On IABDM.
Yes, we do. Yeah, you can post ads.
Okay. Yes.
And you have a person that has a question here. It says, do we pay our staff higher than other conventional offices?
If they're trained, then, so when I'm just, at this point of time, what I'm doing is I'm getting most of the people from Dental Post with no experience in biological dentistry. I train them, and now that I know Dawn is doing all this, I'm going to be sending them her way. Once they're trained and once their weight is worth in gold, you know, you can pay them higher, but it always has to be, they have to earn it, right? In my office, what I do is I give them comparable to what other offices are doing. For my assistant makes $17 an hour, but there is also a bonus system. If we hit the monthly goal, they get a bonus. So I don't like to micromanage. If they're able, they're looking at numbers more than I'm looking at, and they are scheduling strategically. They're like, okay, we need to schedule A, B, and C so that we hit that number. So make them work for the money, and it'll be worth it. They probably, if you look at it, the whole money that they make, it ends up being $20 an hour, which is a good pay for an assistant, versus just saying, okay, I'm going to give you 20. This is what worked for me. I say, I'm going to pay you 17, and you're still going to get 150 to 200, depending upon what the production goal is for the office. So that worked for my office. That, I think that's what I would do. I would pay them comparable to what other offices are paying, spend the time to train them, and then put a bonus system in place to reward for the efforts that they have done.
And I think you'll find that in at least most staff members that have been in a biological office, once they've learned about ozone and homeopathy and everything that is involved in biological dentistry, they don't want to go back to placing amalgams and doing root canals.
Yes, yes, that is true. They're pretty much on board once they understand, once they read, once they, you know, look at all this. It's, you cannot undo what, you know, what you're seeing. Once they look at the amount of care that we are taking, they don't want to go back to the office where they're just drilling through mercury amalgam.
Yeah.
So
biological dentistry is not it's not a cattle barn where you're running people through like it would be if you were in a clinic mandated to see so many patients. So it's a much more relaxed environment, and yeah, I think that I don't know anybody who's ever gone back to regular dentistry. So
yes, yes,
that is an issue. Anybody else have any other questions?
There's one more thing I'd just like to, especially because you said that. My new patient exam is 2 hours long, and we don't do cleaning at that visit. Like, you can call the office and they will say this. And I still make good money. I sit in like face-to-face, eye-to-eye. Most of the time when we're doing dentistry, we just look at teeth, we are sitting behind. We have to, the first visit has to be about making that connection with the patient. 2 hours, we have an extensive health history, mercury symptoms, and these are things that are readily available. have them fill out all of that so that they know that you're taking that time to understand what's going on in their life. It's very important to give them that time. Nobody has given them that time. They've gone from dentist to dentist, PPO practice. You just cannot give that time for you to be able to make some money. So, and that's the beauty of biological dentistry. It gives you that leverage to spend the time, understand your patients, understand the symptoms that they are having at the same time, make decent money.
Yeah. And Dr. Wu made a comment on here as if I had to go back to regular dentistry, I would just quit dentistry. And I think that's how most of us feel. If you had to go back to that world where it's toxic and it's toxic, I mean, you can't do it.
Yes, I agree, 100%.
Well, thank you. It was a wonderful presentation, and I'm sure it's helpful. You look at the difference between what it would be to start a business and do it your way versus buying somebody else's practice and trying to retrain patients, for one, and staff. You just may end up wanting to do what Minaxi's done, so she's laid the groundwork for you there. We will have this recording up by tomorrow, so if you guys want to tap into some friends and say, hey, you need to listen to this, then we'll have it up and ready for you by tomorrow. Okay?
That's
Thanks,
great. Don,
Minaxi.
no problem. Thank you. It was a pleasure. Don, can I have this recording because there are two
Absolutely.
groups?